Hello, today I'm going to be teaching 15 sentences for emergency professionals, maybe emergency medical professionals, EMTs. So one EMT asked me about these types of signs, and he and his team came up with a list of 15 and gave me a list that they'd like to use for emergency situations when they have to ask questions. Before I begin, I need to give a few warnings. First, I'm not an interpreter, I'm a teacher. That means my interpretation might not be the same as yours or someone else's, and just try to understand there are different ways to sign the same concept. So I'll be teaching one or two, but there might be other ways that are right as well. So I'm not a medical interpreter. 2, if you're truly in a medical situation, a hospital, emergencies, the best thing to do is hire an interpreter. Really, you have to. The law requires it. So that's just tossing that out there. And again, it's not a suggestion, it's a requirement. You need to do that. But today I will be teaching signs for those emergency situations where you need to communicate and there is no interpreter present. Third, this video is for 15 sentences that were suggested, but I also suggest that if you are a medical professional, you can learn fingerspelling, learn the alphabet, maybe numbers as well. Just beginner conversational phrases. And I have other videos that you can watch for that. All right, ready to get going? Oh, before I start, I have to teach a few little things to make it easier to learn the rest of the sentences. First, pronouns. Like he or she and so on. You simply point. You point at where the person you're referring to is. So me, point to myself. You, point at the person you're talking to. He, point over there, wherever there might be a boy. She, a girl. It actually looks the same. Doesn't matter if it's a boy, girl, man, woman. You simply point with your index finger. For many people, you can make an arc or a circle. We is done like this. And then you can also incorporate number, 2, 3, 4, 2, the 2 of us, the 3 of us, etc. But today, just to keep things simple and get started, a good way to learn is to start by pointing. So if you're talking with a person who is sick, you would point toward them as you're speaking to them. You. Where do you hurt? If someone is unconscious and you're talking to their family or friends and asking them questions about that person, then whoever you're talking to you could look at, but when you're referring to this ill person, you point toward them. He is allergic to what, for example? So you're talking to them, but you point toward the ill person. And second, questions have different facial expressions. For yes or no questions, raise your eyebrows. For example, are you deaf? It's different from you're deaf. You're telling someone if you don't raise your eyebrows. But if you do raise your eyebrows, then it's a question. Have allergies? If it's a WH word question, like who, what, where, why, how, when, etc., you lower your eyebrows. What are you allergic to? Okay, those are the 2 things to try to remember. And now, let's begin. Number 1. Are you deaf? So that's you. Deaf, you. You can also ask, you understand sign? You understand ASL? Either of those. You understand sign? Remember that not all deaf people sign. Some might be oral, some might use signed exact English, really cued speech. There are a lot of different varieties. There are many possibilities, so be careful. Don't assume that someone's deaf will use ASL. So you sign, and maybe they prefer not to sign, maybe they prefer to write back and forth. Want to write back and forth? So that sign is just like the exchange of paper back and forth in your writing. So maybe they want to write back and forth instead of you sign. Want write back and forth? So you can suggest options. Signed, ASL, writing. If a person signs something that you don't understand, you can say, please fingerspell. So again, that's please fingerspell. Sorry, number 1 was long, but now we'll go on. 2 through 15 are really just a single sentence. Number 2, medicine. You take what? This means, what medicines do you take? So that's the sign for medicine. Medicine, you take what? Or maybe more general, medicine, you use what? Number 3, you allergic to what? So it's, what are you allergic to? You allergic what? Number 4, do you feel pain? Or are you in pain? So that's feel, pain. Do you feel pain? And then if the answer is yes, so that's yes, you can ask where. Where? For example, pain, where? So I mean, where do you feel pain? Number 5, are you nauseous? Nauseous. Are you nauseous? Or do you have nausea? Number 6, do you have heart problems? So that's heart, problems. Maybe in the past, have you experienced heart problems? Or heart problems, do you have? Heart problems. Number 7, blood pressure. So that's the sign for blood. Pressure. Tend to be high. So again, does your blood pressure tend to be high? Blood pressure tend high, you? Number 8, have diabetes, you can fingerspell diabetes. I've seen some people sign sugar or sugar can't, but for emergency and clarity, you can spell out diabetes. diabetes. Number 9. Lung as well, you should fingerspell. Once you've done that, you can sign lung like this. For example, lung problems do you experience or have you experienced? Maybe lung problems have you already experienced? Number 10. Seizures do you experience? So that's the sign for seizure. In other words, do you have seizures? Number 11. Are you pregnant? That's pregnant. You pregnant? You? Number 12. Drugs, alcohol, do you use? So again, in other words, that's drugs, and alcohol. So again, do you use drugs or alcohol? If yes, then maybe ask when or how often. That's when. When. How often? And again, eyebrows down. Or maybe which. Which. Number 13. Were you wearing a seatbelt? So that's the sign. I've seen different signs for seatbelt, like this, or like this, or like this. There, I've seen a bunch, but seatbelt is fine. Seatbelt, you use, you. Number 14. Did you pass out? Or were you unconscious? Number 15. Start when. So if you needed to know when something began, sign start. Start when. When did it begin? Maybe a problem started when, or pain began when. Okay, so those are, slightly more than 15 phrases that you can use for an emergency situation if you need to ask about someone's health. Again, I strongly suggest first, if you can, you must get an interpreter. Don't assume that a deaf person signs. Best to match their preferred communication. Third, what was 3? Oh, right. Good also to learn finger spelling and numbers. And 4, just be careful. Try to learn more ASL than just these 15 sentences. There may be different situations. But I hope that this has helped start. Before we finish, I just want to offer a few possible responses that you might see. I promise this will be quick. Number 1, yes. Yes. 2, no, no. 3, maybe. Number 4, sometimes. Number 5, every day. Number 6, don't know. Don't know. And again, numbers and fingerspelling you should learn as well. Thank you for watching. Thank you for taking the time to learn and practice a few sentences for emergency situations when you're helping people who are hurt or sick that use ASL. Bye.